everyone, and welcome back to Cardiac Café. My name's Laura DeLise. I am the Executive Director of Four Hearts Worldwide, the nonprofit organization that manages Pacemaker Club, and we're happy to be back with you with a new episode of Cardiac Café, Heart and Motion, exercising after your device. It's the new year. We're all excited about being healthy and getting fit. Today we have two guests joining us to speak on that topic. First, we have Tracey Eller. Many of you may know her from the Pacemaker Club. She is a longtime moderator of the Pacemaker Club and an athlete, obviously a pacemaker recipient. Thank you so much for joining us, Tracey.
My pleasure.
Also
Thanks
have,
for having me.
yes. And we also have Sandra Kreul, advanced nurse practitioner and lipid specialist. She works with the Naples Comprehensive Health and Cardiology and has been practicing this, I think she said, since 1997.
Yeah.
So very experienced in all avenues of cardiology and works directly with pacemaker patients on a daily and weekly basis. Thank you both for joining us.
Yeah, thank you.
Today, as I mentioned, we're going to be talking about heart health and motion. So we're going to be talking about getting back to movement after you receive your device, what recovery and building your confidence looks like with safe exercise. We're going to also talk about different myths that are out there about exercising with a device, hopefully debunking some of those and helping you set your goals. We'll talk about strength and lifestyle and long-term wellness and overall health for not just people with pacemakers, but everybody. And then, of course, close it out with encouraging everyone to live a happy, active life. So those are our overall topics and very fitting for the new year. And we'll start out with getting back to movement after your pacemaker. So with that, I'm going to turn it over to Sandra to start us out and have Sandra and Tracey tell us about their experience and their knowledge and what we need to know.
Awesome. Thank you so much, Laura, and the Pacemaker Club and everyone for involving me. This is awesome. So nice to meet you, Tracey. You know, your story is so powerful and so like many of the patients who come into the clinic. There's always a lot of angst and anxiety when a patient comes in and they're told that they have to have a pacemaker. It is kind of scary, because they're like, they don't know what the procedure's about. And am I going to be able to live a normal life afterwards? So that's a lot of where I come in, because then I can let them know what a pacemaker is like, how it might affect their life, both in a somewhat limiting way in the very beginning when they get the pacemaker, because they are going to have some discomfort in that area where the pacemaker is placed, some little bit of movement limitations until the leads get cemented or secured in the actual heart tissue. But after that period of time goes by, which is about 6 weeks, then the patient's allowed to lift their arm above their head. But until that first 6 weeks, we want to keep the arm right about this level or so. You know, and I always tell my patients, try not to lift with that arm more than a gallon of milk, because that's an easy kind of thing that we all have done. We've all lifted a gallon of milk. So then they have something very simple to go back to and know that, you know, you can move your arm. You can still put on an over the head shirt. You just have to put in the left arm first if it's the left hand side, or the right hand side if it's the right hand side. And then the other arm can be moving whatever is the non-pacemaker side. But that you normally, for most cardiologists, they will tell you it's about 6 weeks before you can actually lift the arm above the head. Tracey, what was your experience?
Yeah, the 6 weeks don't lift it above the head.
Mm-hmm.
I had a sling when I woke up in recovery. They took that away when I was discharged the next day. So I was moving, I would say after the first week, things were pretty normal, other than not moving the arm overhead.
Yeah.
It's important to move the arm to use it. I think that's a trap that some people fall into, is they think of that sling and that they can't move the arm. And that's a mistake, because the shoulder will get frozen.
Yeah,
So you have to force yourself to use the arm. Just don't lift, don't raise it.
Yeah, exactly.
It's really good to wash your hair. You can wash your hair without lifting your arm over your shoulder.
Yeah, exactly.
I'm on device number 6. I'm really good at that.
Oh, there you go. Yeah, you know, you got it. The other thing too
Oh,
is usually we tell patients not to drive for the first week after insertion. And then after that, most of the time, patients are allowed to drive after, especially a pacemaker. So was that kind of your experience as well? About one
yeah.
week not to
Oh
drive?
gosh, that first one I don't remember. Another thing, I was told not to go swimming for the first 6 weeks
For
because I
sure.
live near the beach. Do
Yeah.
not go in a body of water that's gonna have bacteria until it's really well closed up.
So it's really well healed. Exactly. Yeah, for sure. Well, that's awesome. So, and then otherwise, and I agree with you in regards to moving that arm, you still got to like kind of like move it this way, but it doesn't take real long, about 6 weeks before those leads actually start to have the cardiac cells start to actually grow around the leads. There's different kinds of leads. Most of them have like a little curly cue at the end, and we actually secure them by a little twist that goes into the heart muscle on the inside of the heart. And so then the heart cells on the inside start to grow actually around it. So, yeah. So that's why it's that 6 week period of time because it's that healing on the inside of the heart besides on the outside where that incision is.
Yeah. Now, I was out walking from the time I was discharged from the hospital. I
Yeah,
had so
absolutely.
much energy when I woke up, I could not sit still. I got in trouble in the hospital for getting out of bed and pacing the halls because I had so much more energy than I did before.
Yeah.
But I was walking a lot up until
Mhm.
that 6 weeks was up.
Oh, yeah, for sure. Walking is super important. Start moving and keep moving. Yeah, for sure. Yeah, absolutely. That's great. Good points. I love your
Yeah.
motivation and positive spirit. It's always nice to, hear the stories of a patient who's been really, really already seen it, experienced it, and now it's such an amazing experience with a pacemaker.
Yeah, no, when I
Yeah.
get a new battery, I wanna feel like I eked out every bit of that thing
Yeah, exactly.
before I move on to the next one.
That's awesome. Yeah, for
I have
sure.
a question for you, Sandra and
Yeah.
Tracy. What would you say? Because we run into this with the Pacemaker Club sometimes. People are discouraged, and they're feeling discouraged after getting their device. And I think there's obviously, like you said, an adjustment period. But what type of advice would you give them to try to raise their spirits and help them see the positive of what just happened, of the procedure they just went through?
So when I counsel my patients, I really tell them that the pacemaker was put in for an exact reason. It helps to augment the actual electrical conduction system of the heart. It's going to help to make that heart beat stronger, okay, and more in synchrony. And after you get through that healing process, just the harm kind of thing, you do start to very quickly, honestly, just like Tracy said, you start to get more energy. You start to feel better. You become more accustomed to having this pacemaker. More than anything, I think it gives patients a sense of confidence to know that they have the pacemaker. And if the heart is going too slow, it's going to pick up that heart rate. And so then they can do their activities. They will have more energy. They can do what they didn't used to be able to do. Because let's say if they didn't have any energy because the heart rate was too slow or whatever was going on, they didn't have that cardiac output, then all of a sudden you start to build that cardiac output. It's not, for many times, it's not always instantaneous, but for other people, it is immediate. Like they come back and they're like, I can't believe within the first couple of days, I felt so much more energy. So everybody's situation, like in their experience, is a little bit different, but also the support of patients with a pacemaker is outstanding, really. Tracy, what do you
Yeah,
think?
I think that when you're told you need one, it's scary,
Mhm.
it's intimidating. I know when I knew from the time I was about 12 that one day I was going to need one,
Mm,
and they wanted in the '70s, they didn't pace kids.
no.
So I always thought it was this horrible thing we were gonna put off as long as possible.
Mm,
Nobody ever told me I was gonna feel great.
yeah,
So,
yeah.
my heart rate had dropped to 20 the day I had emergency surgery to get the first pacemaker,
Wow.
and going from 20 to 70s is
Oh,
just amazing.
life-changing.
Nobody ever told me that little detail that I was gonna feel so good. So
Mhm,
I think a lot of people, they get in it's hard to wrap your head around it. People get intimidated by the thought that there's gonna be this little computer in there, but
mhm.
once you start to feel better, I think it gets a lot easier just to trust it and forget that it's there and just move on. I know, yeah, we always get some people on the forum that think that life's over and they're never gonna be active again, and we're like, "No, you're gonna be a little bit limited for the next 6 weeks, and then you're gonna go do what you wanna do, and you're probably gonna feel a whole lot better than you did before."
Absolutely. I agree 100%. The patients, when they come in after they've had their pacemaker, they might have a little tenderness where the device is, but that's it. I mean, they are good to go. So they're driving in, they're walking in. That's like, amazing. Yeah. So yeah, life changing for sure.
Yeah. 'Cause
Yeah.
it could take a little time to adapt. I think something that a lot of people don't expect is the mental aspect of it,
Yeah.
because the doctors, it's a very simple surgery, but it
Yeah.
is a little bit to wrap your head around. But
Mhm.
once you get back and feeling good again, it's a helper. It enables us to live a full life. And I
Absolutely.
wouldn't have nearly the full life that I do without my pacemaker.
Mm-mm. Yeah. Yeah. Completely agree with you.
I think
Yeah.
that's really amazing that sometimes you just need to be told you're going to feel better.
Oh, for
We
sure.
don't think about that, with because it gets very technical. It can be very technical.
Mhm.
And so the bringing it back down to the reason we're doing this is so you feel better and you can be active.
Mhm.
Yeah.
Just really important. I'm going to tell all of the doctors that we work with that they need to make sure they say that to their patients.
Yes. Yeah. Yeah.
I think, well, sometimes you just have to, it's one thing to hear it. It's another thing to go out and go, oh, wait a minute. I'm not getting dizzy right now. I feel really good. So
Mhm.
sometimes you just have to experience it and, get a little further down the road. And when you look back on it, you're like, oh, that really wasn't the big deal I thought it was going to be.
Yeah.
It was just a little bump in the road. And now I feel really good.
Yeah, sometimes the patients will come in and they've been so progressively getting weaker with less and
Mm.
less energy. They don't really realize,
Mm.
exactly what's going on. All they know is that they're fatigued. And then we'll do an EKG in the office, and all of a sudden they've got a very abnormal heart rhythm and they need a pacemaker. And so they kind of like look at you and, what do you mean I need a pacemaker? And it's that shock, kind of scared feeling. And then when they come back in and they have the pacemaker implanted, and they're feeling amazing and they're living a normal life and they're going shopping and grocery shopping and vacuuming again, which the husbands love, because the husbands don't want to do it. Just kidding. Sometimes they do, not often. But then they're like living a full life again. It's game changer.
Yeah. And
Yeah.
sometimes you don't realize how bad you felt before.
No.
And some people even think, well, why am I getting this thing? I don't have any symptoms. And then after they get it, they're like, maybe I did have some symptoms in there.
Yeah. Yeah. Yeah.
Because it comes on so gradually and everybody's busy, everybody's stressed. And so you
Mhm.
write it off to something else.
Yeah. Oh, I had
And the bottom line was, it
flu.
wasn't all those other things. You just needed a faster heart rate.
Yeah, that's exactly. Yeah, for sure.
Yeah.
Well, I think, like you said, every patient is a little different. Listening to your body and to your, setting timelines for yourself based on how you feel is important as well. So if we move on with that and talk about, what are some basic guidelines for exercising with a pacemaker. And maybe Sandra, you can start us out with that as well.
For sure. Yeah. Just like I was saying, about after 6 weeks, you have really no limitations. But pretty much immediately, we tell our patients to start walking right away. We want patients to be out walking around, doing at least walking around the neighborhood. We don't want you in the pool or the ocean or anything like that until that incision is fully healed, which sometimes can take 4 or 6 weeks. Everybody's a little bit different, but really make sure that that's fully healed and you get the clearance from your cardiologist or whoever your provider is that you're following with, just to make sure that they say, okay, you can go ahead and do that. Because if you've got any kind of like an open wound, a little bit of a scab or anything like that, it can come off. And that could be a source of infection of that incision. And so you definitely don't want to do that. But definitely start to, because these pacemakers, when they're put in, oftentimes, just like I said, patients start to slow down over time and they don't really realize that they are become deconditioned, out of shape. And so all of a sudden you get this pacemaker and you start to feel better. So I tell my patients, I want you to sit down and write down every 2 weeks. I want you to increase your walking by 5 minutes every week. Okay. Because then they have a goal and they know, okay, today I walked 10 minutes and you walk 10 minutes every single day. And then in a week or 2 weeks, you increase it by 5 minutes. So every 1 to 2 weeks, you increase your time of your exercise So then you can gradually start to get reconditioned in shape again. You don't have the level of shortness of breath, and it sets you up for success. Okay. And so instead of saying, oh, I'm going to go to the gym and I'm going to do 30 minutes and I'm going to do the elliptical, it's too much too fast. I'd rather have you start with a very slower program where in short order, you're going to get back into shape and you'll be able to do that 45 minutes on the treadmill and the 30 minutes on the elliptical and go out and do your rowing and your kayaking and all of that. So that really is one of the things that I really enforce with my patients. Make them write it down so they know exactly, okay, this week I'm going to be doing this. This week I'm going to be doing this. And so they have those goals and then they have something to look forward to. Because when you start to feel better and you can do the energy and you're not short of breath and you feel like you can truly live a full life, it's incredible. Absolutely incredible.
Tracey, was that your experience and how you handled getting back into being active?
Yeah, well, actually, I'm a little different. Being congenital, I was never active before I got that first pacemaker. I grew up not allowed to take gym class, not allowed to do sports. My rate was 44 and it never went above that. So I never did any of that. So the day I was cleared and told I could do whatever I wanted, I went on the way home, I bought a tennis racket and I bought a pair of rollerblades and I joined a gym.
Wow.
Oh, that's awesome.
So I tend to work with a coach that understands my cardiac history because I'm really bad about going full steam ahead. If I can, I want to try it. And she reins me in and makes me slow down and makes me actually after each replacement, what they've told me is I kept pushing. Can I do this? Can I do this? Can I do this? And finally my doctor's like, do not work up a sweat for 6 weeks.
Mm-hmm.
He's like, you can do whatever you want that doesn't work up a sweat.
Yeah.
So that kind of limited me.
Yeah.
Working up a sweat's fun. After 6 weeks, you can work up a sweat.
Yep, exactly. Absolutely. Past that 6 weeks, go for it.
What are some signs for either one of you that the patient should slow down or maybe is trying to do too much too quickly? What are some of the symptoms and signs that they need to be aware of?
I think to me, because I deal with an older patient population for the most part, because I do adult cardiology, if they start to get lightheaded, short of breath, too fatigued, things like that, they start to feel like even like their legs weak because they're not used to having that muscle strength because they're not used to doing these exercises, kind of take a step back, make sure you're hydrating enough water because if you're not hydrating or eating properly, those are two big things, that can really affect your energy level. And so to make sure that you are able to sustain that level of activity.
Mm-hmm. Anything else you would want to add to that, Tracey, from your experience?
I would say if you start getting the settings that they send us home with are not one size fits all, and they're also often meant for somebody sedentary. So if you run into problems, if you're like one thing I ran into was I would all of a sudden I'd be feeling great, and then all of a sudden I felt like I had a wall. It turned out that I was hitting my upper limit. And it would cut my rate in half because it thought I was in AFib. It was a safety feature. So they turned that off and then that stopped happening. A lot of times if you're very active, your upper limit that they send you home with probably is like 120, 130, which is not adequate if you're active. This is more after the 6 weeks, not the first 6 weeks. But anytime something doesn't feel right, if you have a home monitor, send a download or give them a call or ask to be seen because it's not at all uncommon to need to tweak those settings to get them fine-tuned for each of us.
Yeah. I had a patient who came in last week and their lower rate, was actually set too low. So their low rate was set at 50 and they really needed it at 60 and they felt so much better. Like they felt like a normal human being because he was a younger guy, a heart rate of 50 was just too low, and so then we set that lower rate up. So then the heart rate comes up. And then you're right, because then we can extend that upper limit of the heart rate out. But we often make those changes at around 6 weeks after the device has been implanted because there's like a safety margin for that first 6 weeks. But that's like behind the scenes device manipulation numbers. So,
but if it takes 2 or 3 tries to get it set, that's okay.
Yeah, that's exactly right.
That's perfectly normal. It's totally okay if they adjust it and you go home and try to go for a run and it doesn't feel good, go back and do it again.
Exactly. Yeah. Yeah. We can adjust it all the time. Super easy.
And once you get it adjusted, usually it's locked in and you're good forever.
Yeah.
Definitely.
Yeah, I was just going to say we see that a lot, I think, on Pacemaker Club regarding settings, and it's definitely not one size fits all, and
Mm.
everybody's different, and activity levels are different, and how your body responds is different, and and all of those things. And so I think it's important to note. I said this in the last episode we taped, which is communicate, communicate, communicate with your care provider.
Yeah, believe it or not, we don't ever get tired of hearing from you guys. Send us the messages. Let us know what's going on. Let us know how we can help for sure.
Perfect.
Yeah. There's
Yeah.
no reason to, I mean, sometimes people don't want to bother. I've never had a problem with that.
No.
If something's going on, it's better to call and be told it's nothing
Mhm.
than suffer when you don't need to suffer or be ignoring something serious that's going on. If the settings aren't working for you, get ones that do.
It also gives you peace of mind to know that, what you're feeling, it's okay, it's completely normal, or nope, we can go ahead and adjust that. And so it gives you like comfort as well.
Yeah. Perfect.
Yeah.
I agree.
So it sounds like kind of gearing up to, setting realistic goals and gearing up to increasing your activity is, especially for those who maybe weren't quite as active before getting their device, is really important. Because you want to make sure that you're being active, but in a realistic way for where you started, and then setting goals that again are realistic to where you want to go. And you can do that with your healthcare provider, with guidance. And so is there anything else really you want to talk about or mention about setting those goals?
I tell my patients to start, like, especially after the 6 weeks, and I really start to push the patients. I really do. I'll get them into, like a cardiac rehab type of situation where they really start, rocking and rolling and moving, getting them into. When my facility where I work at is a huge gym. Okay, and cardiac rehab is part of it's a 2-decker huge mammoth gym. And so we have cardiac rehab in there and physical therapy and everything you can imagine. And so I get them involved in that gym and they feel more secure because it's also in the healthcare setting. And so they feel secure that way as well. But again, I tell them to do that to like planned exercise increase. But also, I start to really focus on heart healthy eating. I mean, the basis of health and wellness is maintaining a super clean, healthy diet. And in the world of cardiology, we really promote the Mediterranean diet. It's applicable to any culture. Okay, it doesn't matter where you're coming from, but it's really a way of eating that makes it much more clean and healthy. So you get rid of like the deep fried foods, things like that. And then when you get healthier foods, more chicken breast and salmon and more of the vegetables, have everything baked, grilled, or barbecued, start trying different like recipes and things. Then you can start to feel more energy from the food as well that you're having. And then you can start to, along with the exercise, if you've got some pounds to drop, then the pounds start to very slowly kind of come off. Takes a little work, but it's very, doable and encourage you to do that as well. Also maintain like flexibility. Don't be afraid to do those stretches. Do the yoga and the tai chi and all of that. So we got a lot of patients down here and in the area where I'm working at down here in Naples. And it's amazing what my 90-year-olds do out there. And we actually have a stretching center. And so everybody goes in and then they get stretched and they come out and they're like so limber and they feel amazing. And so all those sorts of things, I think, really makes a big difference. Yeah.
And Tracey, anything that you would like to add to
Um,
setting goals?
I've always been very careful about my diet and exercise because I can't control the electrical problems I have, but I can keep my arteries clear and I can keep my muscles strong. So that's always been a priority to me. I don't want to complicate I've already got problems I was born with. So I don't want to complicate that with things that could have been prevented. To me, that's just kind of the height of stupidity. Like, why wouldn't I take care of myself? Because I'm fortunate that the problems I was born with could be fixed. There's a solution to it and it helps me feel really great. So it's on me now to take care of myself and to eat right and to exercise right.
Absolutely. And I think all of those suggestions are for everybody, whether you have a device or not.
Yeah.
It's important for us all to eat healthy, maintain flexibility, set realistic goals, and keep ourselves as healthy as possible.
No, for
So
sure.
let's talk about some of those myths that maybe patients have either heard from, the rumor mill, or maybe just came up with by themselves out of not being knowledgeable, and try to debunk them a little bit.
Sounds great. Love
Yeah.
it.
So the first one is I can't raise my arm long term. I think we talked about that one quite a bit. But if
Yeah.
either of you have
Yeah.
anything to add, I think it's
Just
important that you do raise your arm, is what we have found out.
Absolutely. Yeah. And
Yes.
so it's really interesting because I do get patients who will come in and they're like, no, I read on Google, good old Dr. Google, that I read on Google that I can't ever raise my arm again. And then what happens is that the shoulder gets frozen. Okay. And then you got big problems, and unfortunately, very sad. I've seen that one too many times. And so I encourage my patients, no, 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 no. Even like in the first 6 weeks, really start moving that arm. And then at the end of the 6 weeks, I have them clapping, okay, and really start working it, really start stretching it out. Super, super important.
I shouldn't strength train.
Tracey, I want to hear your opinion. I've got good, strong opinions about this one.
I love me a barbell.
Yeah.
Weights, I don't know, they just make you feel good.
Uh-huh.
There's something just powerful about picking up a heavy weight, a weight that you never lifted before, and you're going a little bit heavier than the time before. It's an empowering feeling, and it's good for your bones. Like, I'm menopausal, so I've got to worry about keep maintaining my bone strength. Weights are great.
Yep.
I
Absolutely.
know there's some people that are afraid to do certain moves like butterflies or overhead. I have never held back.
Yeah.
I did CrossFit 5 days a week religiously for 10 years. My leads were just fine. I never modified.
Yeah, that's awesome. Yeah, the only thing that I would add is like sometimes people's arm strength is just not strong enough to handle like a free weight, you know? And so I tell them it just depends. Everybody's different, to do like a weight machine instead. So then, like the barbell couldn't like accidentally fall on your chest, So, but yeah, strength training is very promoted.
Yeah,
Very
it's
promoted.
good for you. It makes you feel good.
Yeah.
It's a great stress reliever.
Yeah.
It's impossible to feel stressed out or anxious when you've been tossing some weights around for an hour.
That's
It's
exactly.
just, to me, it's just like the best way to start the day.
Yeah. And then you get that muscle tone, and it doesn't matter how young or how old. When you start to see that muscle definition, my patients come in
Yeah.
like, look at this, they love it. They love it.
Yeah, it feels
For
good.
fun. Yeah.
Great. My heart rate can't increase.
Well, that goes back to the how the pacemaker is adjusted and what the rates are. We can adjust those rates to whatever. We have some patients who will increase that heart rate up to 70 because they feel better. Other people are at 60. They're fine there. But that heart rate can increase. The pacemaker itself will track and it'll go up. So, yeah, that's so not right. The heart rate absolutely goes up.
I think some of that from the Pacemaker Club is almost some patients initially may be afraid to reach that higher limit for fear of something happening with the device and then it not working properly. What happens when you do reach that upper limit of the settings typically?
Tracey, what have you experienced?
My first devices only went up to 150. And I've got AV block, so my sinus rate's perfectly normal. So when I hit that 150, it didn't feel so good. So I would concentrate on staying around 145. And then I got one that went to 210. Put me on a treadmill, and I got on the treadmill, and we saw that when I'm on the treadmill and going to full capacity, I was like 160, 165, and I still felt good, and all my vitals were good. So they set me at 180. So I had a nice cushion over the high rate that I would normally get to running.
Yeah.
So my settings were done on a treadmill.
Yeah, you want to kind of like have that really custom, almost like a custom fit to what your needs are, along with the provider. And putting a patient on the treadmill is exactly what we do, because then we can kind of see like where your rates need to be. And having a pacemaker, there's monitoring your heart rate is about the same as if you were to not have a pacemaker. What we do is we take 220 minus your age, and you take 85% of that, and that's kind of like where your goal exercise target heart rate is. And so you don't want to really necessarily want to push yourself past that, in an older patient population. Just depends. Again, unique to each individual. But yeah, definitely work with your provider so that you can get a good heart rate variability so you can really get your workouts in.
Excellent.
Yeah.
That kind of leads me to the next one, which is about fitness trackers. I think there's some questions about, do they work? Do they not work? Are they a positive thing to use? Could they mislead you somehow? Do you all have advice, or do you use them? Or what is your standard, go-to comment on that?
So I have patients of every single realm who come in. Some people have got their Apple Watch or their Garmin that they wear. Some people wear their Oura rings. Some people have got the Cardias that they do. Some people still have a flip phone. Some people, they don't want to have anything at all to do with it. So I'm all over the spectrum. I can tell you, in my patients who do use all of the wearable devices, they do work. Every so often, pacemaker beat will look like an abnormal beat, but it'll be on the patient's phone. And so I'll get into the patient's phone and I'll take a look and I'll explain to the patient, this is what's happening. This is this beat. And so then they can kind of like learn as well. I use it as a teaching tool as well. So they become more comfortable. But I have found that they work. Do you wear them?
Yeah, I use an Apple Watch.
Uh-huh.
I use Strava to track my activities. I don't focus too much on what my rate gets to.
Mm-hmm.
If I can talk but not sing, I figure I'm at a good pace.
Yeah, there you go.
That's my guideline. So some days that's 120, some days that's 150. My rate tends to be all over the place. So I just go, if I find myself singing along to the music, then I know I need to step it up a little bit. I'm not pushing hard enough.
Oh, there you go. That's a good way to think
my
about
super
it.
sophisticated technique.
There you go. Keep it simple, right? I love it.
Yeah. But I mean, I found that it's very accurate though. And sometimes people worry that the watches are going to affect the pacemaker. They're not. The newer pacemakers they're not affected really by much of anything.
No, no. The newer ones, no.
And once upon a time, I had to be a little bit more careful, but not with the newer devices.
Mm-hmm. Yeah, exactly.
I look at my charts, but I don't really stress over them and spend a lot of time focusing on them.
Yeah, depends upon how you feel.
Yeah, I want to work up a good sweat. I want to feel like I pushed myself. Whatever my heart rate chart shows that day, that's fine.
There you go. That's awesome.
I think that goes back to listening to your body, right? And
Yep.
And last but not least, is in terms of the myths that we have written here, is I'll get shocked if I exercise too hard. I think this comes from, first of all, needing to know the difference between a pacemaker and an ICD, and when the ICD might shock you. Like, what is it that actually triggers a shock? We can address both of those things.
So a pacemaker is normally utilized in a patient who's got an electrical system that needs help to make the heart beat in a regular fashion, or in a fact that the electrical system starts to not be effective anymore. So it kind of like is an artificial pacemaker. It's a pacemaker, so it's going to kick in and make the heart beat when it's supposed to, and will increase in rate as you exercise. A defibrillator, an ICD, tracks the heart rate just like a pacemaker does. It's always a pacemaker, so pacemakers are always included in ICDs. And so the ICD, it's programmed so it will identify a specific rate and rhythm, okay? And it will know that, let's say, based on your rhythm that you needed to have an ICD placed, it will then track. So let's say your rhythm that needed to be shocked, okay, was tracking at 220, because we know this from studies before an ICD is put in. Then it will know that if you're tracking a heart rate of 220, let's say, then it's going to track it and it's going to say, okay, we're at 220 and at X amount of like milliseconds, okay, we're going to shock. Okay. And so it will shock. And when it shocks, it actually stuns the heart. So it goes back into a normal rhythm. So that's the role of the ICD. Different, slight, similarities. but different. Okay. We also have some pacemakers that are called bi-VICDs. Okay. And so there are leads at the top and the bottom. And we can then synchronize the bottom part of the heart so that we can increase cardiac output. Okay. And so then that's really helpful in patients who have had long-term rhythm problems, big heart attacks. Sometimes there will be viruses that will weaken the heart muscle. Okay. And so a variety of different reasons, though that kind of a pacemaker can be utilized as well. So different reasons, different cases, different scenarios.
Perfect. If you're exercising and you say, and using your example, you reach that 220 heart rate rhythm, what happens then if
it would be unlikely that you would be exercising to a heart rate of 220, honestly,
Okay.
because it's an abnormal rhythm.
Okay.
Most people, when they exercise, you would exercise to a rate of 140, 150, 160, something like that. And it's a narrow complex. So it's a different morphology.
Okay.
And so so it's just different.
That's good to distinguish between those two things, because I think there is that fear, that if your heart rate did get too high, that, something might happen. But to your point, it's unlikely to reach those limits that an ICD may be programmed at.
Yeah. A lot of patients too, by the time they get an ICD in, they have rate limiting medications, beta blockers, things like that purposefully hold the heart rate down. Okay. And so it's a whole different, world of pacemakers, really.
Got it. And that's something, obviously, as a patient, you would discuss what you can do, what you can't do, what your limitations are, and how to go about maintaining your health and exercising and activity within those parameters that are for your case specifically.
Yeah, exactly. For sure.
Okay. Are there any other myths? Tracey, have you come across any in the Pacemaker Club that you have found interesting or unique?
You've always got somebody going to tell some newbie that they can't wear their Apple Watch. Oh, yes, they can. Yeah, the biggest thing is just interference. People get worried about interference. And thinking back to when they used to have the microwave warnings, things like that. If you've got a pacemaker old enough to be affected by a microwave, you've got much bigger problems than that microwave oven. Like I said, your Apple Watch is not going to hurt it. Your Garmin is not going to hurt it.
And most pacemakers now are, or at least a good majority of them, are MRI safe, where that used to be a concern as well. So they're virtually indestructible from my understanding.
Yeah.
Okay, great.
The one thing is kind of like a side note more than anything. I encourage my patients to, especially in any of the patients who are prone to wear a bra, an underclothing supportive type of clothing. Make sure you have a really good supportive, bra or something like that, because what can happen is if you've got unsupported breast tissue, then that can make the actual pacemaker become more tender, and it can actually start to migrate down a little bit. Okay. And so we've seen that quite a bit too, that if patients don't wear their supportive garments, they think that, oh no, I've got this pacemaker, I can't put anything on. And so when it's a fresh incision, yes, but after it's healed, absolutely.
Interesting. Good point. So I think we're coming to the end of our discussion. I think that we've talked about a lot of different, very realistic ways to approach movement in the new year with your device. And I think, the title of this slide kind of sums it up, is really start where you are and work your way up, as you both have talked about, building the simple, realistic weekly movement plans, building good eating habits, maintaining flexibility, and remembering that your device is your partner. And I think, what Tracey said earlier, that you actually are going to feel better with your device, are, the takeaways from this. What else would you add to that?
I have to, agree with, the device is your partner. And it's not your restriction. A lot of people are afraid because they have a device. And so I make sure that my patients also, they put that information on the medical, alert kind of information on your cell phone. We used to use those medical alert bracelets. I don't know if you guys are familiar with those. Sometimes if my patients still have the flip phones, I'll tell them to get the medical alert. And so it's got medical information that they do have a device. So if they do have, an older type of phone, then I'll have them do that. Otherwise, when you put that information on any kind of more like a newer cell phone, as a paramedic or an emergency person, you don't have to get into the person's phone. It's right there on the front. We just touch it and you don't have to have a code or anything. And then we know who to contact for emergency and what the emergency type of, device, or if you got an allergic reaction to something like that. It gives them confidence as well to know that, if you were to be shocked by the device and they're on the ground, then, and the cell phone is there, then anybody can pick that up and see.
Mine's all set up.
Yep, exactly. It's so important. A lot of people, they don't realize that feature is on the cell phones. And so I teach patients all the time about it. So
Perfect.
yeah.
And I think one last thing I just wanted to kind of talk of again is using your tracking and your devices. Or is there anything you wanted to add maybe on the pros and cons of them? I know that you really encourage it with your patients, Sandra.
Mm-hmm. I do.
Do you tell them to look for certain things, or is it
It depends. It depends, because a lot of patients, they'll come in and they'll, the Fitbits are not super accurate that I found. There can be some oversensing, with patients with, pacemakers and such. Their technology is getting better for sure. The Apple Watch and the Garmin's are probably most accurate. And the Strava's is great too. If they're prone to using wearable devices, I definitely embrace it. If they're not prone to wearing wearable devices, I just kind of let them do their own thing, work out according to how they feel. We're going to know whether or not there's a problem, because the remote devices will be sent automatically in an unscheduled, comes across at our end in a healthcare provider. There's an unscheduled remote device. It'll automatically come across. And so it goes to our device clinic. And so then we've got a whole team. And this is all they do every single morning, is they look at all of the reports that have come in overnight. And then we take a look at the rhythms and what's going on. Is this a real sense? Was this an oversense? Like, what was going on? And so there's that backup as well. So go out there, live your life to the fullest. Have an amazing time. And absolutely, these devices are your friends.
Tracey, do you want to add to that?
I would say, with having the devices, don't get obsessive about it.
No.
It's easy to start staring at those charts and making too much of it. Just go have fun.
Mm-hmm.
It doesn't have to be, it doesn't matter if you spend exactly 16 minutes in your target zone. Just go have fun, work up a good sweat. Unless you feel bad, don't worry too much about what your heart's doing and what your pacemaker's doing. If you feel bad, then you stop and go back and you can send in an interrogation. But as long as you feel good, just keep going. Don't worry about it.
Well, I want to thank you guys for joining us tonight for this Cardiac Cafe episode, Your Heart, Health, and Motion. I think we really touched on a lot of good information for everybody, whether you have a pacemaker or not. We have up here just a few resources that might have some additional information for our viewers. The one we added here was the cardiacathletes.com site for those specifically who are looking for some additional information there. Thank you both very much. And we appreciate your time, your expertise, your input. And with that, I'm going to close out this session, and I hope you enjoyed it.
Thank you for having me. It's nice to meet you, Sandra.
You too. Thank you, Tracey. Thank you, Laura.
Thank you.